stand here. But, good afternoon, everybody. Thank you for joining this meeting, this week's new meeting, which is hosted by the Center for Environmental Occupational Health. To thank both people that are present in the room and also those online. Thank you for attending. It is a great pleasure to introduce this new meeting. The speakers will be Professor Sean Patrick from the School of Public Health Systems and Public Health of the University of Pretoria. He's also a member of the Chemical Alliance Africa. And Kevin Dornbrack, who's a doctoral fellow at the University of Oslo and also board member of CCA. And CCA has commissioned a study. CCA is we all part of CCA. I'm the chairperson, and Kevin and are board members as well. We are a non-governmental organization which focuses on endocrine disrupting chemicals, the harm that it causes, to make people aware, different stakeholders aware of the harms and the health effects, and also to be involved in an initiative which reduces the exposure or eliminated the use of these chemicals in the workplace and in the community. So CCI has commissioned a study, and Sean and Kevin will be reporting on those studies, looking at the situational analysis, firstly of the research that has been done in the EDCs, focusing on in South Africa and Africa, and also Kevin focused on the policy on EDCs on the continent as well. So I'm looking forward to the presentation. So the report has been finalized. It is available on the Chemical Alert Africa website, which is chemicalalert.org. So I think maybe Kevin or Sean might just show the website. If you go to the website, you'll find some interesting information about EDCs, about our work that we've done. And in the section the CCA at work, the report is the finalized report is available. We can access it. And I would also encourage you to sign the register. Where if you just leave your email address, and all of those online will get your email address, where we can show you the send you the flyer which has a link to the finalized report. So thank you very much. So I now call up Sean as the first speaker. Your presentation.
Okay. Thank you very much, Prof, for the kind introduction. Today I'll be taking you through the first report, and the first report was really to understand what is the current status, or what the research around endocrine disruptors and some of the emerging contaminants are in the country. So, here we go. So I'll take you a bit through an introduction, just a very brief background on what some of these endocrine disrupting chemicals are, what their definition is. We'll talk a bit about the reason for the situation analysis in the first place, the methodology that we used, and methodology will follow the results as well. So a scoping review, but to place that into context, looking at the geographical regions in South Africa. So trying to map the findings to the geographical regions and trying to understand the use of the chemical. So a framework used to visualize that, the driving the forces, pressure, state, and impact, and then trying to sort of think of that in a conceptual way. How do we look at how these chemicals actually need to be assessed, and at the last step, thinking about safe chemical management in South Africa. Based on the findings, what are these next possible steps that can be done? And that kind of feeds into the work that CIA is doing by looking at community-based work. So aside from these two studies we'll present, there is more work that has been done. And this sort of foundational work talks into the conceptual framework as well as the monitoring evaluation plan, thinking forward. How do we incorporate the findings with the legislation and policies? So very, very broadly, we know that the sustainable development goals address all these challenges, poverty, climate, and so on. But there's one specific goal, goal 3.9, and that really deals with reduction in deaths and illnesses from these chemicals in our environment, and they're present in different matrices, right? So whether it's air, water, or soil. So by definition, by looking at some of the research that's been done, it's also important to be able to report that, whether in which of these matrices they do appear, whether it's in air, water, and soil, because thinking about long-term education and monitoring support to understand where these chemicals are. And what that goal really tries to do is to bring their attention to these chemicals, and specifically a set group called endocrine disrupting chemicals, which is one of the mandates of CAA. So what are endocrine disruptors and why do they matter? Well, there's been quite a number of work that's been done internationally in particular. One of the major chemicals that actually start all of this is your chemicals such as DDT, which has been used for many, many years for malaria vector control, for example. So we'll see that we have pesticides on the side here. So a lot of the work has been focused on pesticides. Yes, they're beneficial, but they also have their unintended harmful consequences, and they linger in the environment or they persist in the environment for long periods of time. So it's important to understand that majority of these chemicals were created for one purpose, but now they have unintended consequences. One of the major consequences is effect on health and reproductive health in particular, and there are numerous studies being done on them. But aside from just the pesticides, there are other chemicals as well in the manufacturing process of your plastics, for example. So a lot of these persist in the environment. And when we were thinking about what types of studies are we looking at, there's many things that are published on all of these chemicals, but you have newer chemicals that are starting to emerge too. And that's actually where the major concern comes in. There have been many studies being done about bioavailability, about removal, and the half-life of some of these types of chemicals. So when you think of some of the newer chemicals, and we call them emerging chemicals of concern or chemicals of concern, and these are really, whether they are organic compounds, inorganic compounds, from microplastics, flame retardants, artificial sweetness, for example. We know as far as medications are concerned, there are newer types of formulations that don't always degrade as you would intend. They land up in our environments. The biggest issue with emerging contaminants are we don't really understand, one, where they're distributed, two, what the concentrations are, three, what the mechanisms are, so how do they actually behave. And then lastly, if they are in different matrices, how do you identify them and how do you remove them? And also how do you think about informing the community about its potential risks? So the situation analysis, which is part one, really looked at identifying what are some of these chemicals that are of concern, particularly within in our context as far as South Africa is concerned, and trying to really understand what concentrations there are, where they are, in which part of the country they are, and what are some of the things that we can do about this. So in terms of the methodology, so we started with a scoping review first. So all of this is detailed in the very large report, so I'm not going to all the details. But the idea was to look at everything published in the last 20 years. So in South Africa, what has been done, right? To sort of start from that status quo. So those scoping review was done, but in order to visualize this, because we now knew that in which areas of the country things were being done, we used a program called Tableau. And Tableau is quite interesting because you can look at geographical location and you can map the studies you have to try and identify which chemicals are present in which areas in the country. So if you think of in terms of education, there might be one chemical that's prevalent across the country. That will be a wider type of reach. If it's specific to one area, it might be an industry in the area, it might be something more in particular. So that's why the reason for using Tableau, visualize the data, and then you can add all of these other visual layers. Then thinking about the chemicals we are finding, what is their purpose? What is the need for that? And so trying to look at why is this chemical being used? What's the driving force behind this chemical? Is there any pressure to either limit the use? And DDT is a good example. There was a lot of pressure to try and reduce its use. So think about these chemicals, what can be done in terms of state? What are some of the policies and governance around that? The impact on the environment, and how do we sort of respond to all of that? And linked to that, sort of thinking about what this vulnerability assessment would be. So creating the data, seeing how this can be done, and then coming up with a framework to start and potentially address that. So just a bit of detail about the scoping review, all of the different records that we found and included, and in the end, what about 100 studies and some of the reports that we included in the assessment at the end. So what I'll show is the different types of chemical, and I sort of try to put everything together on one chemical on one slide, right? So it's not all the detail, but just to give you an idea. And I think if you look at the entire report, it'll add a bit more detail to that. So we do know that your bisphenols, for example, so in your plasticizers, often bisphenol is added to the plastics into your thin foods, plastic linings, the receipts, for example. So when we looked at our study in particular, we found in Gauteng, Limpopo, and the Western Cape, in our study, that's more, all the studies, that's where bisphenol was found in most of the higher concentrations in the matrices leaked into soil, impacting on wildlife. And there's also been a huge move to move away from bisphenol A, and there's now other alternatives, bisphenol F, bisphenol S, for example. So there's all the replacement chemicals that are coming in. So as a starting point, we've not even looked at bisphenol S and F. There's only one study that's actually looked at replacement chemicals at this point in time. It is a huge concern because it is being banned internationally. Yes, it's still being used in some of the products that we are having, particularly in those three provinces. And in South Africa in particular, BPA has actually been eliminated from some of the baby products. That's one positive step that we have made towards that. And now if you go into the shops, most items are labeled BPA free. For example, doesn't have BPA S and F in it as well. A big concern is phthalates, which you see is across the country in many different matrices. Phthalates are found in bottled water, your cling wrap packaging material, for example. While there's regulation around it, the biggest issue is that they leach into the environment and contaminate the soil and the water. So you're now looking at effects long term. While we did introduce an extender producer responsibility regulation, there are still some issues that need to be addressed, particularly because you have those two phthalates at the bottom, which are breakdown products, for example. It's only in occupational settings where there's actually exposure limits that are being set, and not for the public in general, who are actually using these products more and more. So there is a huge concern. So one of the immediate things that need to be done is more awareness around phthalates in particular. Next one we found was PCB, also predominantly across the country, and PCBs in electrical equipment or building materials, and again also leaching into the soil, the water, and in the food chain is concerned. There are some laws around that, but actually we need a more comprehensive legislation around electronic waste. That's actually where the major concern actually becomes around that. Then we looked at some of the really emerging contaminants where very few work has been done, and things like paraben, for example, which in your personal care products, your shampoos, your lotions, your sunscreens. They often also end up in the water systems, and they're difficult to remove. Yes, there are some regulations around that, but what actually needs to happen is amendments to specific responsibilities for manufacturers. If you're producing the product knowing there's an environmental harm, how do you then manage that? So while there is education, but also from the producer side. These are polyfluorinated PFAS. So these were actually also found in the majority of the country, and these are can also accumulate more as now some examples are in the rivers, for example, And we've also got the studies that have shown it's persistent in the environment for quite a long period of time. While we do have a bit of regulatory framework is not complete, there are bits and pieces around the other regulations we have. But there are certain things like, for example, the forwards, for example. Some of the other places have actually started removing them from their products if they are aware. So yes, there is some awareness, but it's actually not. It's not. Toluenide is we all found that in the studies report in 3 of the provinces, and these are also have particularly in the as far as the aquatic environment is concerned. While we do have regulation on hazardous chemicals, they actually only mention the use of it in your perfumes and fragrances, for example, which is actually not ideal because it does actually land up in systems, for example. And then PPEs, these are your flame retardants. They showed up at landfill sites in Gauteng, for example. And one of the studies in particular that looked at the exposure is actually through dust, and particularly then toddlers who are walking around, they potentially then be exposed. While there is also some regulation around this, does not specifically target your retardants. And then lastly, of the chemicals we looked at, triclosan is also found in your plastic containers, your food linings, receipt papers, and they also tend to leach into the water. And while they're still approved for use, there are some restrictions that are being considered right now due to their persistence in the environment and the impacts. We actually see that in the US, the FDA has actually started looking at some of these types of chemicals. So if you take all of those results together and you sort of put them together and you look across the provinces, and this was quite an important slide because if you're thinking about where do we start, what do we do? Yes, while there is in Gauteng predominantly, most of the studies have been done there, and we are finding most of these chemicals in all the different matrices. It's quite clear that your PCBs are across the country in majority of the matrices, as well as your PFOAs and your pellets. So looking at what are the follow-up studies that need to be done, it's either where there's no information in the other provinces. That may be a good starting point to understand what is going on, because in these past 20 years, we have not found any published studies reporting on these types of chemicals in those matrices. So that might be a next logical step. As part of CAA, we've actually tried to do this as far as the phthalates in my group, also looking at these in the Limpopo province in particular, where there's a bit of a limitation. And we have found phthalates in the air and in the water, for example. So that's one positive step to try and identify where some of these chemicals are and concentrations in particular. So I'm not going to go into too much detail because I think the report sort of breaks this down into different sections describing each one of the driving forces, the pressure and the state, for example. So this is a nice framework to use, because when you look at the results, while the studies in South Africa have been done, looking at all of these emerging contaminants, and we've now framed them geographically, it's important to understand what are the driving forces behind using these emerging contaminants in the first place. And they go around industrial development. Most are replacement chemicals, so BPA, BPS, and so on. There is consumer demand too, right? So we want everything to be easier. It's in plastic, but yet there are some unintended consequences. So where the pressure really comes in is that we are using these, but the disposal is always a problem. We note that this plastics is a good example. Plastics are not disposed of correctly. They biodegrade over a very long period of time. They become microplastics. So there's quite a lot of issues around there. We do know there's evidence of environmental contamination as well as human exposure. And so throughout some of the studies, we're seeing these effects and impact to potentially be. And really what the response needs to be based on this, and where CAA really sort of fits in, is in that bottom block. We're thinking about this public awareness and education about these chemicals, looking at the concentrations, and also through research and to monitoring of these sites, that is really where we can really come down to what EDC regulation is actually needs to look like.
But maybe
So if
the
you then
other
take
thing
that
is,
together and you look at what the vulnerability assessment framework
is to see
is trying
if you
to
get
exposure
some
assessment, for example, those are the chemicals, the studies have already been done, and geospatial analysis, which we very simplistically try to put that together geographically. I can obviously be done a bit more, but while we know whether, what in my opinion what needs to happen next is look at demographic factors. So who are people that are exposed? Is it a drive for the chemicals? In Gauteng, we see the newer chemicals being used consistently. Is it due to newer chemicals being used, the industry changing, the demand being higher, for example? And then try and link that to the DPSR framework. And what you're really looking for is these coping capacities at the end, where we are, through the work we're doing, trying to develop all of those, leading to a framework and what Kevin's going to present on what some of the policy limitations and recommendations are. And that really would link back into, if we understand what's happening, how do we address that in order to better to regulate EDCs in this thing. And then sort of lastly, thinking about how do we do this, we've sort of come to step number one, really, where we've taken one step forward to identifying these emerging contaminants at least. Now there's a bit of responsibilities, right? So from a researcher's point of view, through the work that we're doing, trying to identify the chemicals to see what are some of the long-term effects, but also from a community point of view to educate and inform. The CIA, we've sort of done one, we piloted some of that work, and it can actually be done, and really to advocate for these safe practices. So about 3 slides, just trying to take what we found from the scoping review, thinking of different frameworks that we can try and visualize the data in. What are some of these things that we can come up with? And I think the one thing that's quite clear is that we have these chemicals at varying concentrations in almost all the provinces. And what I did not show is sort of the one of the maps that overlaps all of these different types of chemicals. But we know that there's increase in developments in the chemical industry. More newer chemicals are being produced, but yet there is no associated environmental, well, not, I won't say no, but it's not properly documented what the impacts on the environment is, particularly in EDCs, because it's proven to have all these health abnormalities. And then it actually calls for an improved regulation, and Kevin will deal with all of that now, really to advocate for the stronger comprehensive regulatory frameworks. Important to promote public health, promote public awareness and education, because it's all good and well to say don't use the chemicals, but if you're in a situation where that's all that you have, there needs to be an understanding of why it's harmful, what can be done. If it's burning of plastics, instead of burning it, perhaps not a single-use plastic, but a reusable plastic might be a better alternative. So it's just those, just to try and educate. And one important aspect is to continually monitor. We know that some of these chemicals do bioaccumulate in these matrices. So it's important to understand which matrices they appear in. So then when you monitor them, you can see whether or not those concentrations would increase as time goes by. And then we can try and see how we can have proper strategies to mitigate those. And then lastly, really to look at advocating for industry-based practices. There is a big drive for thinking about chemicals that are actually products that are biodegradable, or designing products itself that are biodegradable and don't have some of these negative effects, or have effects on the reproductive system or hormones system. But it really needs this multi-stakeholder collaboration. And I think the CA is one of those sort of platforms where you can do the research, you can go out in the communities, but bring these stakeholders in to talk about this is what is currently happening. How do we inform the community, but how do we move forward in thinking of what we need to do? So, and this last, just to thank CA for the funding to do the scope of review, and sort of just to tie together, it was important to understand what the situation is right now, where there are limitations, and it's quite clear, not while we pick these chemicals to look at, there are still some gaps in the literature. So that's a great sort of follow-up research question. What are these gaps? Can we identify it? Can we quantify it? And are there any methods to remove it or to educate, is to reduce the use? Thank you very much.
Thank you very much. That's excellent work and presentation. We were very happy with your work and a very eye-opening report. We're going to leave questions for later when Kevin finishes his report. So I hand over to Kevin. Kevin, pleasure to introduce you for this presentation.
All right. Okay. So I'm Kevin Dornbrack. Just for some context around the way I'm approaching this, I'm doing my PhD in anthropology at the moment. So it comes from a very sort of different angle to what Sean is coming at from this, and I'm looking at the sort of policy, regulatory landscape, and a bit of the existing programs that are running or the work being done by NGOs. As Sean ended off saying, it's important at least to take the first step to understand where we're at the moment with EDCs in South Africa. This is kind of what I'm trying to do with this report, is to just look at where we're at policy, regulation, legislation-wise. This is just a sort of brief overview of the report to give some examples. Obviously can't show all of the acts and regulations. I'll be here for hours. Okay, so I think Sean has covered most of this in terms of what an EDC is, sort of an external substance which is in some form disrupting our endocrine system or hormone systems in the body, and there are a whole host of potential adverse health outcomes that come from it. Just an indication of the range of places where EDCs exist, which is what part of what makes it quite difficult to regulate, is that they really exist in a wide span of consumer sectors, like a wide span of government oversight sectors. And this is also an indication of the different publics or populations that are perhaps more or less exposed to EDCs. For example, the cleaning products at the bottom left, you may find cleaners or domestic workers being disproportionately exposed to certain types of EDCs from that. Okay, just for the structure of the report or this presentation, we're going to spend most of the time on legislation and regulatory framework. I'll briefly mention organizations that are doing work at the moment that is relevant, then name a few additional chemicals, some geopolitical and economic factors, and then finally conclusions and some recommendations. So there's no specific legislation towards EDCs in South Africa, so it's kind of best described as perhaps a kind of patchwork. They emerge here and there, seldom named as EDCs, but they sort of exist as different chemicals, and sort of which Sean alluded to. There are 15 different acts that I found that were relevant to EDCs in some form. They generally deal with management of occupational hazards, protection of environment, trade standards, and providing the authority to particular individuals or departments to regulate in a particular way. And it's spread across 7 government departments. This was a figure that was produced before the most recent government and cabinet shift, so it may have changed since then, but it's sort of would still be at least roughly accurate as a figure. Moving on to the regulations and policies, this is sort of a wide view of regulations, policies, strategy documents, draft documents, management plans, just to sort of a wide scope to see what has been produced by government or commissioned by government in terms of what they see as relevant for chemical management, and what we've seen as relevant for EDCs. And just sort of a brief overview to say there does seem to be a lack of cohesion, as you might expect, and certainly a lack of implementation of existing regulations, which do hold some promise. I'll just deal with one example here of regulation to identify a particular lack. This is for the 2021 regulations for hazardous chemical agents. As Sean pointed out, they do deal primarily with occupational exposure. This doesn't deal with consumer exposure, which is a very large part of what we need to be concerned about in terms of the public's exposure to EDCs. Just a few of the issues here. They don't deal sufficiently with occupational exposure for BPA, as well as nothing for BPS or BPF. And some of these regulations do exist in the EU, for example, so there is precedent to set the occupational exposure levels for these. Certain phthalates are regulated under occupational exposure and certain ones aren't. PFOA is no longer produced in South Africa, at least, and I believe PFOS too, but there are other PFAS substances that are suspected endocrine disruptors, which should be, if we're using a precautionary approach, should be regulated in some form as well. And then we also have the PBDE and as well as DDT, which Sean mentioned. That's something that, many would argue we shouldn't be using at all, and also doesn't have an occupational exposure level, which is quite concerning. Given that there are many reports of DDT escaping their confined use of only being used indoors for vector control in certain areas. They seem to be being used as insecticides as well in an illegal way. So just some other noteworthy strategy documents and draft policies, just to show that there is some work being done that is promising, even if it tends to sort of fall by the wayside. I think it's worth mentioning, noting things that are being done that are interesting or useful. So one of them was the Chemicals Management Bill, which was a concept document. It wasn't a bill itself, but more it was a concept document. It was a short presentation, but it did highlight the need for reviewing the current use potential of toxicity. So reviewing chemicals that are currently in use as new science emerges, to review if they pose toxic threats that perhaps were previously overlooked. So, for example, in the EU, they have review processes that regularly bring up chemicals for review every 5 or 10 years, depending on the chemical, to see whether they're still with current science, they're appropriate for use. We don't have any kind of system like that in South Africa, which would be a very useful one. South Africa only seems to ban chemicals unless they're included in international conventions, or if the tragic death that happened in Soweto a few months ago, there were suddenly 24 kids that died from tuberphos exposure. Then, luckily, recently there was, a few days ago, the ban of tuberphos approved in Parliament. Another one of these, and perhaps the most interesting, was the Department of Forestry, Fisheries and Environment commissioned document called the Inventory of Endocrine Disrupting Compounds and its Management Action Plans in South Africa. So interestingly, this document was not published. I can't find it anywhere online. I managed to get access to it through a colleague, but it seems to have just disappeared into the ether, but started off with very promising goals, at least. So it aimed to do, as it said, an industry assessment, both of formal and informal sectors, to list names of companies, locations where EDCs are being produced, identify what those chemicals are, what volumes are being used, and grade their level of toxicity. It aims to identify major exposure pathways, largely through consumer exposure, so not just the occupational exposure, sort of aiming for to fill that important gap. Also to identify EDC hotspots, much like what Sean has been doing, in identifying sections of the country where studies have shown higher levels of exposure. Aim to review best practices globally and then suggest recommendations for how to manage them and for alternatives. This was also a significant source document of mine for the legislation that is included in our report. One last one, as far as suggested policies go, there was a pesticide management policy produced by the Department of Agriculture in 2010, which responds to the 1947 Act 36, the Agriculture Fertilizers, Farm Feeds, Stock Remedies and Agricultural Remedies Act, which is extremely outdated now. So it calls for a complete overhaul of this act. It suggests an inadequate recognition of the Bill of Rights, because there's no recognition of the right to a safe environment in this act. It highlights the insufficient penalty of maximum fine of 1,000 rand for not complying with this legislation, which, if you put in the context of a major farm company who is breaching this legislation of a fine of 1,000 rand is insignificant, to say the least. So it calls for a review process, like I mentioned earlier, that happens in the EU, where pesticides are reviewed every 5 to 10 years to gauge whether they're still the best, whether they're still safe, and whether they're still the best chemical to be used for the context. And it critiques a lack of monitoring systems. This has been highlighted recently by multiple media activity and protests by the organization Women on Farms project, highlighting from reports of farm workers that the inspections done by the Department of Agriculture are vastly insufficient, that the inspectors often just speak to farm owners, they don't speak to the farm workers, and they're often very rude to the farm workers. They don't consider what's actually going on. And an increase in transparency of at least what pesticides are being used in South Africa. The registry is still held by CropLife, a pesticide lobby organization. So as a member of the public, we're not able to get access to which pesticides are even registered for use in South Africa. It's behind a paywall, so you can pay to access it, but even then they determine whether you can access it or not. So people have been denied access because they're not members, even though they've paid for the access to the registry. Just some relevant international regulations. So the EU has made probably the most progress regionally, globally, of putting in legislation, regulations, and banning EDCs, but they do still produce the same EDCs that they have banned to export largely to the global south. There is some progress with countries like France, which have said that they will ban the export of chemicals which are banned for use in France, but there are loopholes, such as they produce the chemical, send it to a country that's not banned for export, and that country exports it, kind of bypassing this law. So it needs to be a region-wide ban from the EU on these chemicals. Just a brief overview of some of the organizations working on EDCs in South Africa. I should have included ourselves, Chemical Alert Africa, in there, but didn't yet. And not to dwell on this too much, but I won't go through all of this, but just an indication of some of the work being done by organizations in South Africa. And just to note that there is very interesting work and useful work being done, and it's sort of, I guess, if nothing else, a plea to government to say that there are resources here, there are people, organizations doing the work. So this kind of engagement with civil society can be extremely useful for being able to produce more coherent regulations. In terms of international conventions, I'm not going to go into any of them, but just to say that South Africa does have regulations to domesticate these international conventions, but those regulations are not always implemented. For example, in the July 2021 riots in KZN, where the UPL chemical plant storehouse was burnt down, it was found subsequent to that there were multiple breaches of regulations. They hadn't informed municipality or local government of the chemicals that they were supposed to inform them of if they stored them. They didn't have the appropriate EIA for being able to be there. They were too close to a river, so there are multiple issues with the implementation of these regulations that do exist. Just a brief mention for a few other EDCs that don't make it into the sort of most common talking points. The maximum levels for lead in South Africa are still 600 parts per million, which is about 66 times what there are internationally. And this is largely lead in paint or in ceramic glazes. There is a draft regulation to set it at 90 ppm to comply with international standards, but it hasn't been passed yet. Acrylane is an interesting one. In the production of the vapor in vapes and e-cigarettes, the herbicide acrylane is a result of the thermal breakdown of those chemicals. And the new bills around e-cigarettes don't don't attend to any of the other chemicals that are being produced in e-cigarettes, just to levels of nicotine, regulating those. I think it's important to note two regional alliances here and the effect that they do have on how we regulate or how we could regulate EDCs. So BRICS is a very development-focused conglomerate, and at least their last few yearly meetings have been quite focused on agricultural development, explicitly with the support of agrochemical industries. So if we were able to shift at least South Africa's input into BRICS towards something more aimed at looking for alternatives, even just to have some kind of political intent to say that we're looking for alternatives would be progress. But this is a big factor in our sort of development discourse that is problematic. And interestingly, further up in Africa, the Sahelian Pesticide Committee has been very effective at banning large numbers of pesticides for use in the Sahel region. And then one significant political factor in pesticide regulation, which those of you working in pesticides will no doubt know, CropLife, the pesticide lobby, or they would call themselves an industry organization, is very powerful representation of industry, agrochemical industry, and seems very enmeshed with government decision making around what pesticides are available for use and how they are regulated. So a few conclusions. So South Africa does have some good legislative framework, even for occupational health purposes, but there's a lack of reference to particular EDCs, which can cause significant issues, as we've discussed. Many of the penalties are inadequate for serving as an actual deterrent for big organizations, for big corporate entities. And the comprehensive government, we need the trend of having these strategies or draft documents, policies produced that lead nowhere is concerning. It's good that there is this work happening, but it needs to have some kind of effect or else it's pointless. While there is a core group of organizations working towards different sectors which relate to EDCs, there's no organization other than Chemical Africa, which we're still in our quite early stages of implementing anything too significant. There's nothing that deals with EDCs explicitly. The private sector certainly can't be left to regulate itself, and there is a dire need of increased public awareness. Just a couple of slides of recommendations to end off. Developing an inventory of current use EDCs would be a start, to know from the government side, to know what our situation is at, what we're using, to be regularly updated. And development of collaborative monitoring systems is important, to know how these things change. It's often expensive to test for these substances, so that also adds a layer of complication for developing these kind of monitoring systems. For example, in the agricultural sector, there should be perhaps certain hazardous pesticides, of which there are dozens still used in South Africa, banned in the EU. Continual monitoring of them to see where they're being used, what are their levels through projects like Prof is doing in biomarkers, as well as levels in associated rivers, environmental levels. And there need to be overarching monitoring systems that track how regulations are actually being implemented, because where these regulations exist, many of them still lack an appropriate implementation. And then, of course, follow up on the policies that do actually hold some promise. And finally, we need strict market-based restrictions and requirement for notification of the presence of certain chemicals. The closest we have to that is the Rotterdam Convention for prior informed consent for import of certain chemicals. But the notification of having certain hazardous chemicals present is important, as the lack of was shown in the UPL disaster. We need more public participation to involve people who are actually being affected by these chemicals, to understand what alternatives can be provided to them, because knowing there's an alternative that you can't afford is not helpful. And the strategies need to be intersectional. We need to understand where these issues are affecting certain sections of the population. For example, in terms of pesticide exposure, often it is the man's job to be spraying, but the clothes that the sprayer is wearing is typically brought home and washed by the woman in the house, and they're the ones and their kids who get exposed to higher levels of pesticides because they have to do washing. So just one small example of where an intersectional approach needs to be taken to understand who is being exposed at what levels and how to deal with that appropriately. Okay, thank you very much.
Thank you very much, Kevin. That was also an excellent presentation and report. We are very happy with both, both reports, and proud to make it now available. And thank you for your, for those reports, for the presentation, and the reports that you've done, and also your work that you've generally doing in your own capacities at your institution. The excellent work that you've been doing. So now, now that we've finished the reports, it's time for questions. So I will first ask those present here in the room if there's any questions. Okay.
Thank you, Prof. As to Prof. Sean, it's quite a trend, because I heard you said some of them, they are starting to use them in sweeteners, and so is it a big thing or quite not really a big thing, because now it's really concerning, but also checking in how your beverage consumption is and so forth. Isn't like people are really on the beverages and so forth, which are made of some of the sweeteners.
I think it's coupled to lifestyle changes. Your people are looking for an alternative, right? And you have your alternatives are your drinks, and those drinks have all these other chemicals. That's sort of what that one the framework was trying to show. What are the pressures and what are the drivers? So if you're going to move away from one product and you're going to move to a different one, if those products have not been really tested or the ingredients have been evaluated, you are going to see more of these chemicals that are being used in all of these replacements, because you're removing one product, replacing with something else that's seemingly safer, but there's no real assessment that's being done on those types of things. And you see many, and also you see many newer products on the market, but the cost is lower, right? So people are going to buy that particular product. But have you actually looked at what those chemicals are and what negative consequences there are? And half the time, no. So yes, it is definitely a trend. We see more of these products appearing in our food.
Any other question? Okay. Just introduce yourself as well.
My name is Myra. I'm from Global Surgery across the street. Thank you so much for having us. Both of you mentioned a little bit about lobbyists, specifically CropLife, for example. What can be the way forward if they have such power or such control over legislation related to EDCs?
You don't need it answer.
I think the one thing is about communication, because if you try and understand from both sides, right? And I think the TT example is an easy example to use. Right? We know that it has offer protection for the households against malaria, for example. Right? So from a lobbyist point of view, you are using a chemical and you are potentially saving lives, right? That's the perspective. But from a researcher perspective, we know these chemicals have many long-term negative health effects. But I think the problem we often have is we don't see eye to eye on these. And how do you really weigh up someone's life versus contaminating the environment for 100 years that potentially influences other generations? And I think we are not having that kind of conversation. It's from these two different points of view where the arguments are the qualifying arguments. But to move forward, so to get to that point, we're saying, then we need to find other safe alternatives, because by continually using this type of chemical, you have unintended consequences. And while saving human life, yes, but you wording I think from the CropLife's point of view particularly, it's having, I think that's where the issue actually comes in. They regulate these chemicals, there's financial implications, things like that. I think that's more of their point of view. I don't think we're at that point where we see things eye to eye. I don't think so.
Yeah, I think I may have a less diplomatic answer to say that we need a more robust legal support for people arguing against the lobbyists, because there's quite a strong legislative framework for protection of people and environment in South Africa. So there's a lot to draw on, and a lot of these. I think DDT is a very complicated one because it is potentially saving a lot of lives, but chlorpyrifos is not saving lives. Glyphosate is not saving lives, and the food security argument has been proven to be, which the Minister of Agriculture is using against banning octoberfos, which is now likely going through, is just false. There are alternatives. I think we need to push the government. I guess civil society needs to do the government's work of finding alternatives that work, but often the alternatives are less one size fits all and more like if you're looking at what pesticides work on a particular farm, it'll be different for every farm because of its geographic location, because of what crops it uses, because of which way it fit, what slope it's on, what other plants are in the area. So I think, yeah, I guess two things: development of robust alternatives and proper legal work to say that this is unconstitutional and there are alternatives.
Thanks. Another question?
I think mine relates to what leaves South Africa ends up in East Africa. I used to communicate with Kenya, so we use in Uganda, Kenya, Tanzania, probably using the icon CS. So what we are sold as a marketing strategy is it's the same chemical that you put on a mosquito net, and the residual effect is about 4 months or so. But the issue with that is people actually don't know what they are, because there is no regulation per se. We are only told that it comes from South Africa, so we are not so sure how it ends. I know you say that they are locals, but from an African point of view, if we are saying we want to prevent malaria and the rest, how be it that South Africa is actually sending high content CS to Uganda? No one is there to monitor, no one is there to regulate, because what you get an average, what you call pest controller or a fumigator, like it's sold to you, all you are told is mix about 4 cups of it in a 10-liter can and just spray now. I think over time you're able to get all these effects, whether it's in your endocrine system and the rest. And I wanted to find out if there's a way from an African point of view that we're actually able to regulate what leaves the country and ends up in other parts of Africa. Is there a mechanism for that, or just asking?
Yeah. Yeah, I think the problem is with chemicals that are used is the development of alternative, and then the legislation that needs to be. There is a good, I think, as they've highlighted both reports, that there is some legislation which needs to be improved, which given a recommendation. And important is for government to play an active role in implementing these policies, improving the policies and implementing. I think that's the most important aspect at this point, where we feel there could be a bigger role, also by government to implement these policies and to improve the policies as well. Anything else you want to add?
Yeah, I think you mentioned about SciCam. I know SciCam tried to do some of that work, kind of harmonizing the policies in African countries, but I don't know how far they've gotten with that.
Well, it's weird. I would like to call it rubbish, for no better English word. Because you get icon CS coming in, and then next 2 weeks you're told it's DASBAN, which has more. When you look at the compounds, chemical contents, it's actually stronger than the icon says. But it's the same thing. They tell you now if you need to, and they tell you it's multi. You could use it for mosquito, use it for cockroach, use it for all these other things. And somehow there is no regulation, and you don't know long-term effects on this. And this is just at informal level. Now the worry is if they are selling you the dream of this is much better than icon says, and it's that one you're using. So then over time, what happens to us as a continent? But we are trying to prevent malaria per se.
It's sorry.
But it's just it's a rhetorical question, I guess, speaking about. But that's what we have outside the borders of our.
From the I don't know that much about East Africa, but I from colleagues working in pesticides in East Africa, the clamp down on free speech and action around opposing any pesticide use is quite scary. I was at a conference in Dar es Salaam recently where they asking an official to release the list of hazardous pesticides that the government has produced, and he just absolutely refused to answer the question. And if he had answered the question, he probably would have been fired. So I mean, Kenya recently banned 50 pesticides, but they won't say what the pesticides are that they've banned, which also seems, there clearly is a whole set of really complex and bizarre politics going on. But there are import and export laws in South Africa that I'm not that familiar with myself, but that should regulate what is exported. I think South Africa can't produce, at least with pesticides, South Africa doesn't have a license to produce pesticides, but it can import and mix pesticides in certain sense elsewhere. I don't know how many of them travel illegally versus legally as well.
I want it to be honest, because if you go to downtown Kampala now, you probably get any chemical that you want. Like there's someone that is uneducated has no idea about what they are selling to somebody. It's just free. If you have the money, you probably have to get it. So that's the level we're at from a whole regulation point of view. I don't think we will be able to have anything done in the next few years or so.
Okay, no, thanks very much for that interesting discussion. So I'll move over now to the online participants. I see there's a couple of points in the chat. Before we come to that, maybe those that made the comment, if you could maybe just switch on your mic and if there's any comment or questions you want to make. Okay, so I don't see any. Bruce, is there anything that you wanted to say?
No, I just, it was a pleasure to be part of the presentations. They were excellent, informative, provided a wonderful, comprehensive overview. The only thing I would like to add, which I think is important in terms of engaging other public health colleagues, is that one of the things that got people initially interested in EDCs was the issue of their impact on fertility. And I think globally there's growing interest, growing concern about infertility to help people make their own decisions about for the fertility and family formation. And I do think this is something that's worth keeping in mind and keeping a focus on. But really wonderful presentations. Thank you both so much.
Thank you very much, Bruce. Bruce Dick is also a board member of CCA, and thank you for that input, Bruce. And I agree, thanks for that recommendation, and there's definitely an area of research that we need to take up. Thank you for pointing that out. Any other questions? I see there's some in the chat. So Paula, President, okay, so Paula would like to have a chat, so we correspond with you. There was also about whether the presentation is available. That can be made. Basically, there will be, this non-meeting is recorded, and there will be YouTube that of the recording, and then obviously the reports themselves are available on the CCA website, and we can also make the presentations available, so that's a good, so one could access the, or otherwise you could also email you individually if you want the presentations as well. You can do that as well. Hopefully you do have the email addresses. Yeah, so.
I wrote down Paula's one.
Sorry?
I wrote down Paula's one.
Oh, okay, okay. Or Paula can just maybe contact me, then I can give the documents via me as well. Okay, so Bruce, yeah, and then I think there was, I think some of the EDCs are prevalent to it, would be good to build capacity to able to test these products. Yeah, thanks for that suggestion, Steve. There's a lot of research obviously that needs to be done, which and that's a good point as well. So thank you for pointing out, and definitely that's a point that one could consider in future research endeavors. And also I wanted to, okay, there's a hand up, Stephen, you can ask, are you, okay, thanks very much. You want to ask a question, Stephen? Okay, that's great. Yeah, and then the other thing I want to say, that anybody that want to join CCA, willing to contribute to the, are welcome. You can just contact us, contact me, and you want to become a member to contribute to CCA, we will welcome that as well. Okay, thank you for that. Okay, so.
And then I think Tebogo had a question.
Oh, he had a question. Oh, sorry. Okay, so maybe you want to answer that?
Tebogo, yes. So the Northern Cape was actually one of the provinces that has not been well studied and documented. It could potentially be the university is not that, it's fairly recent, and I'm not sure what kind of work they're doing there. So that is one province that's very unexplored. And we looked at studies in all of the matrices. So the focus was on the chemicals in the country in any one of the matrices. And so that's why that one last slide had all the different matrices, where we found all the chemicals. So Northern Cape would be a great place to look at.
Fantastic. So it's a master student of mine, and so you're looking at the prevalence of EDCs in the different water systems. Well, a literature review of research that was done on that topic. Okay. Okay, so it seems that everybody had a chance to, there's no more questions. So I want to thank again the two presenters for the excellent presentation. I think it was an excellent noon meeting. So thank you very much. And bring the meeting to a close. Thank you. Okay.